All right, welcome to Unit 6, which is over Chapter 7, Childbirth. The essential question of this unit is how do today's knowledge and practices envision childbirth as a natural process while also providing advanced medical care for mom and baby? So our first unit is decisions concerning childbirth. After this unit, you will be able to assess ways family members can be involved during pregnancy, describe the Pregnancy Discrimination Act and the Family and Medical Leave Act, and explain how each law affects families during the birth or adoption of a child, differentiate among options for a birthplace, compare and contrast 3 methods of delivery. That's it. During pregnancy, family members can be involved in the excitement as they offer support to the mother and help prepare for baby's arrival. The middle part of pregnancy is often the most pleasant for the entire family. Mothers-to-be usually feel their best. Husbands and family members are more aware of the baby because they can see the mother's abdomen grow and feel the baby move. Couples and their children may decorate a nursery and gather items needed for the baby. Couples also take time to plan for the many aspects surrounding childbirth, such as scheduling time away from work, choosing a birthplace, and selecting a method of delivery. Parents have many decisions to make before the baby is born. Because these are important decisions, couples need to research each topic before making a decision. At times, unexpected events may cause couples to change their decisions. One major decision parents make is to inform other children about the pregnancy. Parents often decide to tell young children about the new baby during the middle of pregnancy. To some degree, the timing depends on the age of the child. Older children need to know by the time changes in the mother's body are noticeable. In many cases, explanations occur over time, such as when the child asks questions and when preparations are being made. And we'll talk about that on the next slide. But decisions that parents face, they need to choose a healthcare provider for prenatal care and for delivery. My husband and I chose one that was within our insurance network, and that's pretty much how we chose one. You need to decide a birthplace. We were told that we could choose one of 2 hospitals if that's where we wanted, but we don't have to give birth in a hospital. You can give birth at home with a doula or a midwife. You can give birth in lots of different places. We chose a hospital. My husband is going to be supporting me for delivery. He's going to be my support person. We chose the name Griffin Conroy Jarvis for our son. We're going to try to breastfeed. We've already picked out clothing and equipment and put it on a baby registry. My mom plans on helping me after the baby is born and will be providing some childcare for him. And then work and leave options. I won't be back for the end of the school year. My husband will take the maximum amount of time he can take off work, which I think is maybe 2 weeks. And so we've pretty much figured everything out. So again, with explaining pregnancy to children, to other siblings, you explain about changes in the body of the mother-to-be or how a baby is born if they ask you. Familiarize an older child with newborns. Explain how they look and act. Assure an older child about what factors will remain the same, such as they're going to still get lots of love, they're still going to do certain activities with them, and there will be specific housing arrangements like they will still sleep in their own room or if they will sleep with their sibling. Okay, explain and make any changes in housing arrangements or routines before the baby arrives. For example, if the older child is moving to a toddler bed, explain the reason for the new bed is because they are growing up. Then wait a while before putting the crib in the area for the new baby if they're sharing a room. Engage the older child as a special helper to prepare the house for new arrival. When receiving gifts before or after baby's arrival, plan a small gift or something special for your older child too. When the baby arrives, ask the older child to introduce the new baby to family members and friends. Give them a photo of the new baby to take to his or her childcare program or school for show and tell. Children will often have both happy and sad emotions about a new baby. You need to reassure your older children that they are still loved and appreciated. Older children need to feel that they are a vital part of the family and that the new baby isn't taking up their role. Okay. During pregnancy, parents decide how much time off from work they want to take when the baby is born. The amount of time parents schedule often depends on their employer's leave policies, the mother and baby's health during pregnancy, and the family's financial considerations. Many pregnant women work until just before their babies are born. Mothers-to-be may require a pregnancy leave if they cannot work for part of all of the pregnancy due to health reasons. About 2/3 of U.S. working women are covered by the Pregnancy Discrimination Act, which is a law that protects the right of pregnant women who work. Who qualifies? Pregnant women working for companies that employ 15 or more people, both married and single women, women who work in companies that provide job security and benefits for other medical conditions. Okay, what is guaranteed under the law for the Pregnancy Discrimination Act? An employer cannot fire a woman due to pregnancy or force her to take a maternity leave. A pregnant woman is guaranteed the same health, disability, and sickness leave benefits as other employees with medical conditions. A pregnant woman may work as long as she can perform her job duties. Depending on company policy, pregnant women may be given modified tasks or alternate assignments, disability leave, or leave without pay upon request. Job security is guaranteed during a leave. A pregnant woman continues to accrue seniority and remains eligible for pay increases or benefits during her pregnancy leave or maternity leave. Okay. Employers may grant maternity and paternity leave to new parents. Maternity leave is the time a woman takes off work from the birth or adoption of a child, is more common than pregnancy leave. Maternity leave allows the new mother time to recover from childbirth, regain her strength, and get to know her newborn. Life with a newborn is usually very busy and exhausting for the first few weeks. The mother needs time to rest and adjust to her new role and to bond with her baby. Some employers grant paternity leave to fathers, which is time off, usually unpaid, for a set period after a child's birth or adoption. Paternity leave gives the new father time to care for his family and bond with the child. Men face many challenges in taking paternity leave, such as economic hardship, especially if the leave is unpaid. The Family Medical and Leave Act is a law that protects the rights of qualified employees to take unpaid leave for various family-related reasons, such as maternity or paternity leave. About half of U.S. working women and men are covered by FMLA. Companies not covered by FMLA may have their own maternity and possibly paternity leave policies. So what is FMLA? The people who qualify are employees who have worked at least 12 months for a covered employer, employees who provide employers 30 days notice of the need and take leave when the need is foreseeable. Employees must provide evidence of the need for leave. And then workers in the following circumstances also qualify for FMLA. Worker or worker spouse has just given birth to or adopted a child. Worker must provide care for a seriously ill family member. Worker has a seriously bad health condition of his or her own. And then what is guaranteed under the law? Qualified employees have up to 12 weeks of leave. Time does not have to be taken in a full 12-week block. Leave is unpaid. Employer can pay salary or wages during some or all of the leave time if they want. Employer may require workers to use any accrued paid leave while taking FMLA leave. Employer guarantees an employee can have his or her job or an equal job upon return to work. An employee maintains all health care benefits during the leave time. The length of maternity leave varies from company to company. 6 weeks is usually the minimum length offered, and 12 weeks if it's covered by FMLA. Maternity leave may be paid, partially paid, or unpaid. Companies may grant benefits and a percentage of salary during maternity leave. Other companies might grant a longer unpaid leave, such as several months or a year. And if you choose to do one of the extra projects, it researches maternity and paternity leave in other countries, and they have much longer policies than we do in the United States. All right, some delivery considerations. The most pressing decisions you need to make during pregnancy involve choosing a birthplace and a method of labor and delivery. Labor is the process that moves the baby out of the mother's body. When making these decisions, factors parents may want to consider include the type of care the mother to be might require during childbirth, whether the delivery will involve the use of drugs. Those are both things to consider. All right, so first of all, choosing a birthplace. Parents have several options to consider before deciding where they want their baby to be born. Options may be limited by where you live, who will deliver the baby, and health conditions of the mother and baby, and the extent of your insurance coverage. A family's choice of birthplace may include all of the following. Hospitals. Hospital deliveries are the most common. In a hospital, mothers labor in a maternity room and are taken to a delivery room shortly before the baby's birth. Mothers who require surgical deliveries use a surgical room. The delivery or surgical room in the hospital is the best place for high-risk deliveries. After the birth, mothers spend time in a recovery room before returning to their maternity room. Newborns stay in the hospital nursery. There's a birthing room in a hospital is another option. Many hospitals offer parents the option of a home-like room in the hospital for low-risk deliveries. The birthing room is furnished like a bedroom but has all the needed hospital equipment. A nurse stays with the parents during labor. The doctor and delivery nurses are present for delivery or if problems arise. The baby remains with the parents in the birthing room until the mother is discharged. A birth center. Mothers-to-be who have low-risk pregnancy may offer a birth center that provides health care before labor as well as delivery services. Birth centers are often located near hospitals and employ certified nurse midwives. A certified nurse midwife, which is a vocab word, is a nurse who has special training in delivering babies during low-risk pregnancies. Many CNMs work with hospitals where they can call for help if an emergency arises. One drawback of birth centers is that mothers are often released within hours after giving birth. And then home. Mothers may choose to give birth in their own homes. Home births can be risky, especially when emergency services are not nearby. Parents may lessen the risks of home births by having a certified nurse midwife present for the delivery. The newborn death rate for home births, however, is higher than for hospital births. Then you have to choose a method of delivery. Before choosing a method, parents discuss their options with the healthcare provider. All methods of delivery try to make labor and delivery safer and more comfortable for both the mother and baby. When choosing a method of delivery, parents may want to keep the following points in mind. The length of labor is unknown, but tends to be longer for a woman's first delivery. The amount of pain is unknown. Labor is difficult and requires the use of many muscles. Pain is a part of labor, but if muscles are tense, the mother has even more pain. Any complications will also increase the pain. Unforeseen complications may cause the method of delivery to change during labor. So the first type is a natural childbirth. This is a vocab word. It's a delivery method in which the pregnant woman learns about the birthing process and uses breathing and relaxation techniques to reduce fear and pain during labor. Women who choose natural childbirth do not use any pain-relieving drugs during labor or delivery. The most common approach to natural childbirth is the Bradley method, which is both a prenatal care and delivery method. In natural childbirth, the father usually plays an active role in prenatal study and support of the mother-to-be through the delivering process. Parents may use a doula, which is a female helper who reassures and guides the mother through labor. Doulas, however, cannot deliver babies. Parents also use certified nurse midwives or nurses to aid the mother. Doctors may use the natural childbirth method of delivery in hospitals. At birth centers, certified nursing midwives use this delivery method exclusively. Unless attended by a doctor, natural childbirth is used for home deliveries. Another delivery method is the Lamaze method, named for Dr. Ferdinand Lamaze, the French doctor who made the approach popular. In the Lamaze method of delivery, a vocab word, the pregnant woman is trained to use breathing patterns to keep her mind off the pain. The idea behind the Lamaze method is that women may already be conditioned to fear childbirth. In Lamaze training, the mother learns to focus on something other than pain. The following features describe the Lamaze method. Childbirth training classes occur weekly for 8 to 12 weeks before delivery date. These classes teach mental and physical exercises and breathing patterns needed for delivery. The woman's coach, usually the father, learns the breathing patterns and helps the mother-to-be through labor. The woman receives medication when necessary during labor. Not all women can deliver without drugs, even when they are informed about childbirth. Delivery with the use of drugs. Newer drugs and the way they are given make their use safer for the mother and baby and may make labor shorter. Thus, many women opt for a more pain-free labor and delivery. Drugs are also used when complications of delivery arise. Women may be in the hospital, including a birthing room, to receive most drugs. They have to be in a hospital. Drugs for labor and delivery can be grouped in 3 ways. Sedatives reduce anxiety and are used in early stages of labor. Analgesics reduce pain, but they do not take it away. Anesthesia, also called anesthetics, blocks pain. Drugs may be used separately or in combination. All drugs can have side effects, but in general, anesthesia has the most side effects. And then lastly, fathers as helpers. Regardless of which method of delivery couples choose, mothers need emotional support, especially during delivery. Many fathers act as helpers and provide support and assistance during labor. Helpers tend to calm mothers and reduce their feelings of anxiety. Anxiety can be a problem in labor because it causes changes in the mother's blood chemistry. These changes decrease the flow of blood to the baby, which can harm the baby and slow contractions, resulting in a longer labor. Another benefit of father as labor and delivery helpers is family closeness. Fathers who participate in labor and delivery are there to help the mother welcome their newer son or daughter into the world. All right, so you guys should think about, how do you think social and economic factors impact childbirth options? Okay, so kind of depends on like what insurance you have, what you can get, what you can decide to give birth in. All right, that is the end of this section. Thanks for listening.